Hello, I'm Carol Norson. Here are the top stories from 2 Works for You for this Thursday, January 7th. An ICU doctor working on the front lines of the pandemic in Oklahoma shares his fears for the future. Concerns over bed availability to care for COVID-19 patients are prompting him to take to social media. Dr. Carlos Cabrera is a physician at St. Anthony Hospital in Shawnee, and he shared a picture of notes on an average day of work, and it shows a list of hospitals across the state and their ICU bed availability. Well, that picture makes it clear beds are nearly impossible to come by. He spoke with us earlier today describing what it's like to care for COVID patients during the post-holiday surge.
The entire state of Oklahoma has no beds, no ICU beds. And actually this morning, my partner that worked overnight, he flew somebody to Missouri.
Dr. Cabrera says his hospital and others are bracing for another wave of hospitalizations after the New Year's holiday. Well, here is the latest on the pandemic in Oklahoma. The State Department of Health reporting more than 3,000 new cases across the state, raising the total to more than 315,000 Oklahomans who've contracted the virus since the beginning of the pandemic. There are 39 more deaths across Oklahoma. 8 of those patients died here in Tulsa County. Our death toll for the state now stands at 2,672. Some new data shows more people are spreading COVID-19 without having any symptoms themselves. NBC News senior medical correspondent Dr. John Torres tells us that the virus is spread mainly by people without any sign of illness. In fact, the doctor says 60% of transmission comes from people who haven't yet developed or won't develop symptoms of COVID-19. Our weather forecast looking really chilly in the 40s all the way until the middle of next week. We won't warm up until about Thursday of next week. That's a look at some of the stories making headlines. Stay with 2 Works for You for more updates.